to order at 5 o'clock exactly. Please rise and join me in saying the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, we have 5 out of 5 board members, so we have a quorum. Adam Licky delivered the official notices of meetings.
Notice was provided.
Okay, so did everyone have a chance to review the minutes of
Yes.
the regular meeting and special meeting of June 28th and July 12th respectively?
Yes.
Any comments, questions, concerns thereof?
Other than those provided to Gina
Yeah,
already. I think there was 1 or 2 revisions that went out.
All right, is there a motion to accept the minutes?
I move to accept the minutes as written.
I second.
Okay, motion by Dr. Rude, Dr. Hendrickson made the second. All in favor?
Is this including the special meeting and the regular meeting?
Yes,
Okay.
both meetings.
Okay.
Oh, do you wanna
That's-
break it out?
Yeah, just because I'll abstain from the special meeting
Okay,
since
so
it
let's-
wasn't here.
Let's have a motion to amend that, motion. So let's have a motion to accept the minutes of the regular meeting of June 28th, 2023 first.
So moved.
Okay, Dr. Rude made the motion.
I'll second.
Dr. Jones seconded. All in favor?
Aye.
Aye. Opposed? Abstention? So that passes. Is there a motion to accept the special meeting minutes of July 12th, 2023?
So moved.
Dr. Rude made the motion. Ms.
Second.
Roman, second. All in favor?
Aye.
Aye. Opposed? And abstention?
Aye.
Dr. Jones
Abstention.
abstains from approving the minutes. Okay, but that still carries. Moving on to population health report.
The only real change that came up is the nursing director for Lake and Geauga resigned recently due to some life changes that occurred. So we are posting that job. We do have at least one probably internal applicant that we're going to interview amongst others. There is an interim, or there will be an interim until then. Mr. Graham will approve that.
Yep, confirmed today.
Okay.
Sarah will step up.
So we'll have that. Should be a mostly seamless transition.
Okay, on the Safe Communities, I just had a question.
Mhm.
Where was that accident on the 25th? I didn't hear about the fatal crash. Anybody know?
The,
Thompson.
was it, hold on, let me see.
I don't recall the location.
Okay.
I think there was that. I think there might have been this. There was a single vehicle crash with an elderly gentleman.
Was it on
There was also
Mayfield
a
Road?
bike
in
crash.
Sperry? Oh, it was a bike,
Oh,
okay.
No,
never
there
mind.
were a couple, but,
Yeah, there's more than one.
Yeah.
I think one wasn't fatal though. It was just
yeah, I'm not sure which
I think
one I
it's an
can look,
injury.
but.
Okay. Under get vaccinated,
Mhm.
the paragraph, the state has expressed, that whole paragraph, I was confused. Can you explain what the state has expressed their gratitude, this grant being caught up prior, I was like going, I didn't get it. As of this right now, DH has paid $30,000 to us for grants delivered, less than 100
Oh,
is anticipated to be received.
so with that grant, obviously we're contracting through Lake County for the grant because we were no longer eligible. And so that was part of it. And then also we were caught up with some back billing. With the whole transition, everything, we had to get some stuff, some deliverables back under control, and we were able to do that. So the state was appreciative.
Yeah, it's basically like a deliverable grant where they have to do certain, what they call MOBIs, maximizing office-based immunization, MOBI ties, and then you gotta get inventory to get those, so if they're falling behind the spectrum, the quantity they gotta catch up with by the end of the fiscal year for that grant.
Okay, thank you.
And for those that don't know, so health departments, I think we're one of the odd ones. We have what we call deliverable-based grants, where you complete an objective and you get paid based on what that objective payment was. Most of the grants in the past were reimbursement, where you know, if you spent 5 hours and it was $5 an hour, you got $25 back for 5 times 5. Now, a lot of them are deliverable-based. You complete an objective, you get paid X based on what the objective was.
That's interesting. EH report.
Nothing to add, the only thing, and I think Adam has a map. He did,
Back left corner behind you.
yeah, I'm sorry, it's, the GIS department was planning, was nice enough to make that for us today. But that just shows the areas we've completed testing in, I believe, on, for,
Oh, wow, the pink,
the, yeah,
okay.
yeah, from this angle, it looks like it's all pink, but, so I'm not sure if I'm seeing it right.
And the
but-
green is the salt dome?
Yes, the
Okay.
green is all done. But so we just got our third round results back in, unfortunately, like south of 422 at the very bottom. We,
It does.
it really jumped up to high numbers.
So my question for you is if that parcel has contamination, you're talking about the one closest to the body of water? So what does that mean for that?
Yeah, that's a good question.
Yeah, it's gonna be, we were actually looking to set up a
Okay.
meeting with the EPA next week, because we just literally got the results back
Yeah.
a day or two ago.
I was waiting to hear what you're gonna say
So-
about that parcel.
Yeah.
So yeah, we just had this, and we really haven't even a chance to vet this, make sure the map is completely accurate, but it gives an idea of where things are going.
Okay.
And so we just
Wow.
wanted to give you a quick update on that, and we'll find out hopefully more Monday or Tuesday when we talk to EPA.
I wanted to give you guys
It's-
something tonight, because it's hard to visualize, when we say like, south of 422,
Yeah.
like, what does that mean? Like, there's a
Yeah.
bunch of houses. So this at least, thanks to the GIS folks, was able
Yeah.
to at least, our building department, you said?
Planning.
Or planning, sorry,
Yeah.
planning was able to give us something that is visual. We were hoping not to have that many positives
Yeah.
though below, so we have to talk with Mark Johnson, because we have to talk to him about what the reality is of if we expand that and keep going. 'Cause we only have so
So
much.
right
room.
now, have you done everything you intended to do?
We are way beyond what we thought we were.
Okay, all right.
We-
So
we
we-
can name
We were thinking like, and we're
Yeah.
like here and up. We're
So-
now down to
Yeah.
here and we're still testing positive.
So we've kind of done a ring, like we kind of made one layer and hoped that would be it, and then it was high, so we moved another ring out. So we've kind of been stepping it out and hoping we'll find like kind of the end of it, and we keep finding
More.
something.
Yeah.
more.
Am I to assume that every pink is positive?
That's why I was saying I'm not 100% sure, because I have to check the map versus our data, because we just got that literally like an hour or two ago from their department. So I haven't been able to confirm that, but I think it's very close.
So every pink was tested.
Oh yeah, at least to test it,
So
yes.
the ones that are not pink, were they
The pink is
just
the
not?
tested parcels.
Yeah.
Right, so anything that's not tested may be contaminated or may not be contaminated.
So the houses that aren't tested, we've tried multiple attempts to knock on their door and left message, like literal hangers on their door,
Okay.
not knobs. So, this is the second or third round for those houses if they look like they've been skipped. We've made multiple attempts to get a hold of them by letter or and in person,
Yeah.
and not gotten anything. So we're kind of at the point where if they haven't responded, we're not gonna.
Yeah.
And if,
There's been a
That's
lot of news
interesting.
coverage too.
and if I
so-
remember, I interrupt. If I remember correctly, the ones I circled in blue, ballpark, I think it's the one also down below the square one I did. Those are phase 2. I think there's 7 houses, and that's
Yeah.
ballpark off the top of my head, those were the 7 that are getting tested. I want to say, getting new wells, I think that's one as well.
Once they get the other data, they'll update that, probably have different color codes.
Yeah,
Okay.
Yeah,
Yeah, I guess that's my question.
To
to
clear which of
clarify.
these is actually
So-
contaminated.
Right,
Yeah.
that's,
I
to
just want
clarify,
something-
then that one south of
Tested,
422 has been
south,
tested, but we don't fully know.
So there's a road called McCall Road, and that's where really we got some really high numbers this past
Okay.
time, unfortunately.
So it is our responsibility to keep testing far out until we find,
Well, that's the question.
EPA
Yeah.
may change it.
I mean, I'm not sure, like, you don't know what you don't know, right? I mean, it's just like everything
That's-
else in life.
Yeah.
And as, like I mentioned, we started, I'm kind of drawing the map, we started kind of doing like an arcing pattern out until we
Yeah.
were hoping to test negative. They didn't reach the 250 parts per million. But as we kept testing more and more positive, we kept arching out, and as you see, like now we're down into
Yeah.
this area. That was not expected the first time we talked to EP about this. We were thinking like, maybe,
It's
maybe like
downhill.
this area and that.
that's what I would have thought.
Yeah.
That's like a slippery.
So, obviously, we're doing it to help the public, but as that keeps expanding, that question keeps coming up, how far do we keep going?
Well, so the question I have is, are there any differences like in the levels or what we're defining as our threshold for contamination? Do we get to a point farther down that it could be due to something else, like just
Right,
an
I was just-
incidental finding? Or is it consistent with what you've been seeing from the contamination of the
That's
salt dome?
what they test. If you think there's something else, you have to try to blanket the testing.
Yeah, so right now,
Yeah,
it's been a chloride
Okay,
has been the one parameter that they've
Okay.
wanted us to test for, and that's what they've been running everything off of.
okay,
250 is technically the limit is
Yeah.
where the line's been drawn, and houses, if they've been above that, pretty much have been qualified. The houses that we're just got results from today were almost 1,500.
Yeah.
So regardless of the cause,
So it
there's
is, I will say,
something
it's a
wrong.
secondary, it's a
Yeah.
secondary contaminant too, so just so people
Mhm.
understand. It's not a primary, you're gonna have your impacts on health
Yeah.
and stuff like that. So this is a
That's-
secondary, which is more of a taste, visual, I mean, granted, it's chloride, so it will have effect on a person if it's high enough levels.
Yeah.
But in general, it's more of a taste, smell, sight.
Yeah, not.
It's the most noticeable one,
Yeah.
I'd say, or
I
one
think
of them.
The
So
basic
you have
complaint
some
I,
time.
the basic complaint I tend to hear was in the shower, the roughness of the water, like that was the annoying part, I mean, so, it,
But I would
It's very
think
interesting.
there, whether it's Ohio, nationally, or some other state, this has happened before, there has to be set
Oh,
protocols.
yeah.
With
It's happened in some other-
geography, yeah, geography.
In other
soil
counties in
type.
Ohio, there's not,
Right.
2 counties in Ohio that
I
they
think
said
we
they've
did
had
too.
issues similar.
Hopefully they're reevaluating where the salt dome should be.
they moved,
They're-
it's
Yeah.
totally
I
gone.
know, hopefully they're thinking about
Statewide.
that from the bigger picture.
Right.
So
Yeah.
my,
Over the top of
my
it.
understanding is the new salt domes,
Yeah.
I had got a tiny bit of an education on how salt domes are built now, and they have underground reservoirs that kind of capture everything, it flows down, they can get it out of there. They have, some sort of barricade that also goes around it to help even if it is like kind of washing away.
Yeah.
So there's new safeguards in place for newer versions of salt domes, and my understanding is that the replacement for this one will have those newer safeguards in place.
Right.
Could we?
Can I just follow up on the actual question about contamination? Is it reasonable to assume that salt doesn't skip houses?
Well, the issue more so is where people are drawing their water from. So, you have aquifers underneath the ground.
That's a shared-
And what they've explained to us in this area, they believe there's like 3 levels of different waters. And so it kind of depends on
Where your well-
where you're pulling your water from. So when they're drilling these new wells, they're going down to that 3rd level because it's high quality water. Whereas so far, a lot of the houses that we've dealt with, especially in the first round, were all top level.
Right, but what I'm concerned about are the houses that have not been tested that are in the high danger zone because of the proximity to the.
Yeah,
And we did have,
Yeah.
yeah.
and Dr., we did have some that, like, one neighbor's 1,500 and the next one's 100.
Oh,
And then
Really?
one's 2,500 and one's 30.
Oh, wow.
So they, I mean, like, within, what, I mean,
50 feet. of
yeah,
water.
you can throw a rock and hit their house and it
Wow.
drops off. And that's where we think it possibly is the well. The Berea Aquifer is technically the second and third aquifer, Berea Aquifer, but they kind of viewed as 3 different ones.
Mhm.
The very bottom one, which is like 300 feet down, is considered like the super crystal clear.
Yeah.
The middle one we did drill to the first time. That had it wasn't gas. It was what was in the petroleum product
Yeah.
or petroleum, which is naturally occurring.
Yeah.
It wasn't like it was still, but it was naturally occurring petroleum. So we drilled down to the third, which is the Berea.
But you're correct, Dan mentioned if it's a primary contaminant, it'd be a whole different story, with the secondary, again, it's more aesthetic, I guess.
Yeah.
But it's still a serious concern,
Right.
so just to follow up on that, I'm concerned about the public health and safety of the houses that are in the high-risk zone.
Yeah.
And so do we have a plan for what we're gonna do about people who live in the county who have a high risk of serious exposure, but are failing to comply with a request
I see
that
what
we
you're saying.
test them?
Right, that's probably over the hands of the ODH and legal at this point.
Yeah, I mean, we've tried, they've had multiple, we've
Yeah, I
knocked
get
on the
that,
doors,
but
but
we are a job of public health,
Yeah,
and we should be concerned not just about the people who are willingly complying with our request to
yes.
test, but we should also be concerned about the people who are not willing, but their health is at
Yeah.
risk.
Yeah, I mean, certainly
Well,
education.
so we
part of
also
it.
cannot force
concern.
someone to
Yeah.
comply
Sure.
or get their new
Yeah,
well
we
drilled.
can't force
So
people.
all we can do is offer our services to people, and if they're not gonna accept them,
Education.
that's all we can do. And
But
it's
is
common
it
knowledge.
documented as such, so
Yes,
if,
we've kept documentation of everywhere we've
Okay.
been, what
Yeah,
we've done, what we've
logs.
dropped off. So
because
we
if,
have documentation of all that, yes.
because if Mr. Smith comes back in 10 years and says, oh my God, I've got
Yeah.
something,
Or there's
we
a
can go back and
process.
say, well, Mr. Smith, we,
And we've had someone tell us no before. Like
Yep.
they don't
Yeah.
want tested. They don't
Actually, the
want
guy who lives right
Yeah.
next to the salt dome, he
Right.
says no.
Right.
Water is fine.
But
I guess he's
one-
waiting for a big
No,
lawsuit.
it's terrible.
Can't even give them
And
away.
that's what I was saying, right?
Just said
That's
it.
Several
right,
things,
that's what I was wondering.
along with Dr. Ruth's concern, one of the causes could be that the person just can't respond because they're sick from all this. And you have to consider that too.
Well, it's not a primary, I mean,
I mean, one way or another, because of it, they're not able to
Yeah, it's not
respond.
impossible.
I mean,
Not-
so
Yeah,
they,
no, it's not impossible.
they should be able to, in the aspect that we've talked with the trustees as well, so they know. They've talked to people, Mike Deerfield's talked to, I think, probably everyone
Right.
in 3 counties about this. So, who's texting me now, because we just got we're getting his driveway finished from the repairs, so. I mean, I'm not saying there's not anybody, but in general, we've done everything we can do besides kicking down a door and saying, here's a well.
It's kind of like
Drill it today.
AMA.
Right, with all
Yeah.
these concerns and questions, like we had that one meeting, I might have brought this up last meeting.
Yeah,
We had that one meeting with the township, it would be worthwhile to organize another meeting, but have a lot of these questions developed and review some of the information for protocols
Yeah.
and meet and see where we are and where we're going.
And we do plan to have another, I'm gonna call it a presser, 'cause I'm not sure what else to call that thing. We're gonna have another like a presser at the end of this phase 2. I know Steve Mitro, I think would like to do that, just to follow up and see where things are at, as well as some of the other gentlemen, so, and ladies, so I think we'll have another one. I'm sure the Parkman, community would like that as well. So the plan is to have another one. I just sent over all the contracts to Don and Mark, who won. They need a couple things I need signed from them, and they need signed from me. So they should start drilling, we're hoping, in the next week or so. Dan's getting them the last contact information for all the houses that are included. And then the biggest thing right now is, as we test down, we gotta add those to the contract, and we gotta see where that takes our number, contract-wise.
Yeah,
Right,
'cause
but to develop a plan and some answers or protocols, like the levels, you know, the geology, geography, the soil types, and what protocols are out there, and the time course of those protocols.
Yeah, typically we can certainly get that because there's some prior incidences in Ohio, but with the TPA thing kind of changes the game with a whole nother
Right.
layer. So I think
Right.
we need to connect with them to get the full picture, but.
Yeah, so that's more, the geology stuff is more how EPA, I'm trying to, what's the guy's name that does all the, I think he's out of Twinsburg.
Oh, I can't remember his name.
He did the presentation with us.
Yeah.
Because we don't really do geology here, so I've been
Right,
working
right.
with them, and they've got all that, because they provided it the
Right.
first time, so.
Yeah.
So I can understand that people might be distrustful of us being a governmental agency. But
It's a big crux.
I would also postulate that they might be more trustful of their neighbors and their neighbors delivering or helping us deliver a message.
Well,
So
yeah.
that's
Yeah,
why
and
anything we can do with communication where the community gets involved in the process of helping us with these residents who have so far refused to participate
Yeah.
would be time well spent from my perspective.
Yeah, we can certainly put that together at the
Yep.
board's wish, if that's the direction you want us
Yeah.
to take to escalate that, that's absolutely fine.
And I forget the name, but Geauga County had another episode back in the 70s or 80s. I remember finding that when I was looking at
There was
this.
one that was up in Chardon, but that was the Salt Dome too, wasn't it? That was up in Chardon, I think that was the city too, and that's township, it's past, yeah, it was Chardon Township.
The question is how many other salt areas are in the problem in
Yeah.
county or state, you know?
But at some point, we have to learn
Yeah.
and get to a better spot and plan.
And this, it's my understanding, this is very unusual how this one played out. Usually you've got to sue to get a well, so this is very unusual that they stepped forward and did this. This is not the commonality, this is the oddity.
Well, your all's persistence.
Mike Deerfield is very persistent.
Yeah.
I try to help, but Mike Deerfield's very persistent.
Yeah.
Love to death.
But noted that we'll take an increased
Yeah.
enhancement to get
Yeah.
some education information out.
He gets all the credit.
Mhm.
And we think we can wrap this up by August 31st.
That is still the date, Dan's getting the Hans information for those homeowners that are in the phase 2. Once they get that, they're hoping to start drilling like next week or week after, so.
This
Still like-
seems tight to me, but I don't know that much about.
I think they're expecting to knock those out probably within a week, because they're all next to each other. They're gonna move that,
Alright, great.
the drill left and
Yeah.
right.
Okay.
Okay, so I have a question on another topic, the campgrounds.
Yes.
So how long has the campgrounds been there before?
This is the farm on the riverboat. There's multiple now, but it's kind of,
Are there fines for these people who didn't follow the
so health
rules?
departments we don't have the fines, the ability to fine people. But maybe Thompson zoning might. I mean, but their main thing, it's more of a, all we do is educate them on the rules that we enforce and requirements. If you go above a certain limit, then you have to get a license from us. But the zoning rules at those locations are actually very much more strict, that you just can't have campgrounds.
Yeah,
So,
Scope of authority.
so we've gone through and it said, done some education at the two locations we've become aware of, saying, this is the health department rules, but the zoning rules are much more strict, and you need to probably deal with zoning before you deal with us at all.
And this is, well, not identical, somewhat similar, like there's the Airbnb discussion going on right now in this county, and even in, Madison was actually on Fox 8 News, this morning, because they're trying to get Airbnbs, and there's an argument between like, do you want Airbnbs or not?
Interesting.
And so between lakefront communities, the wineries, and then scenic
Yeah.
Geauga and all there's that discussion as to, do we want to open that up so we can make revenue, but at the same time, do we want people coming in and possibly like having parties next to someone's like, their house there at 24/7?
It's residential.
So it's definitely it's a big thing for zoning coming up for how they're gonna handle that stuff.
Never easy.
That's not our problem, though.
No,
Nope.
Today.
Next segue to the next
Yeah.
topic.
I have a question on the.
Speaking of things that are our problem.
Inspections.
Yes.
Can you explain to me why there's 4 for sale of property inspections?
We offer it as a service still,
I see.
so we don't, it's not mandated, but if people want us to do that, we still will do that for them.
Yeah, so just think inspection versus for sale property, language, I suppose, yeah.
So that keeps us legal, because then also it's a, they could go outside of us if they want to do that,
It's
so.
a choice.
we have gotten a couple calls, realtors like, can I, the bank says they have to have it. Yeah, we'll do it as as
Yeah,
a
there are
option.
some bank loans that still require health departments to do that.
I think
So,
FHA and some of them.
Yeah.
Not to compete with the private sector, we're not here to do that, so that's part of it as well.
Okay. Administrative report, any other questions on that, going back?
We just, I went down today to Summit County, we were able to partake in a tabletop discussion about COVID with the state, with what went wrong, or what was done right, what was done wrong, things like that. I think that was beneficial to the state. We've asked for years for them to listen to us about what they do, and this time they actually hired 2 mediators from OSU to come down and listen and document, and they're putting it all together. So we were the northeast region, and then they should be, I think they already did southeast, and I think they have central, northeast, northwest. And they're gonna have another online one that's open to like all the health commissioners. So I think that was beneficial, because there's things that went right, and there's things that could have been done way differently, and so it was just appreciated they actually are listening.
Did they talk at all about the future identification and prevention?
Not at this one so much, just in terms of like
Just
how
COVID.
we hit
Right.
Response.
yeah, kind of how we responded, what we would have done differently. But I think that is coming up. That is a discussion that's occurring. Is how could things have been done differently?
Well, when there's a pandemic every 100 years, you're in different
I'll be long dead.
generations.
We hope it's not, all right.
Yeah. I have a question on yours. The operations and maintenance program that's gonna roll out on the 2nd of August, where's that gonna be?
That one's gonna be at Elgar, so that's the Lake Geauga Realtors Association. Lake Geauga Realtors Association. That's starting with them first. They'd asked for one a long time ago, so we're gonna start with that one, and then we're gonna do Chester and Chardon. Those are the 2 next ones, because those were the first NPDSs to roll out.
So when you go to Chester and Chardon, is it what, to their township meetings? What's it?
Yeah.
So,
Okay.
we're starting with their township trustee
Okay.
meetings to give a short
Okay.
presentation, then we'll have a public meetings in those 2 locations also after that.
Okay.
And they'll be like 5 o'clock or after, so the public can attend. They're not gonna be like at 10 in the morning on a Tuesday.
Are these gonna be recorded at
I
all?
was just gonna ask.
That was some discussion as to record them, make them available, and then we just gotta work that out. Like, I
Maybe
don't-
not the first one, maybe like
Kinks
a
out.
later one.
I would like to work some kinks out, yes.
Or you can do a video
Um,
But I think it might be good to
live.
put on our website just for those who are
Yeah,
not able to
Yeah.
attend.
Yeah, we have discussed that. It would be, maybe a certain company that we all know. We have someone come in and help us video, so.
Maybe you'll have questions at that one.
Right. Just keep feeding Coke and, like drinking Coke, not.
Yeah, be careful.
Yeah.
Watch out,
careful.
Hunter Biden.
That's how HR got involved.
Financial reports, is that where we're on to next?
Yep.
Alright. Adam, let's talk about the $4,000 we spent on envelopes, is that?
Yeah, I had
categorized, right?
So we actually were like completely like zeroed out on envelopes, so we had to get new envelopes, and those are for all the different mailings that we do, a lot of EH.
How many envelopes do you get for $4,000?
A lot.
So,
A lot.
and I will say that
For
once we
lifetime
are up
supply,
and running
hopefully.
on them, we'll probably be looking at going through to what, 10 to 15,000 a year at least.
Wow.
Okay, yeah, that was there.
And those are windowed, and those are with our name and return already stamped on them, and they're the self-seal, like you pull the thing and you seal them, so.
But again, a lot of that's statutory requirement
They're
for
made of gold.
notification and
Yes.
response.
Big old toilet seat.
The 5,600 for the
Yeah,
Public
that
Health
was-
Accreditation Board.
Yeah, we have to pay that every, around how many times?
Annually now.
It is annually now,
Okay.
yeah. Before it wasn't annually though, it was every,
You could pay it up front, or you could pay it
that
over.
was, yeah.
That's just like a
structured
fee
plan.
for maintaining accreditation,
More punishment to
membership,
it's
or,
maintained,
okay.
yeah. Right now, I mean, it's required, part of my report is working with the state to figure out what some opportunities may be. We have a meeting with April Harris, who's from the national board. There are some caveats for these kind of contract relationships that they thought they would honor, like kind of the pass-down accreditation, not to say it would still be work as doing two counties. That's kind of been taken off the table and to put everybody in limbo, but to remind them that they threatened that to public health, but none of it may be beneficial, it kind of has disappeared, so I'm not very happy about that, especially with the fees that we're paying, and,
Yeah.
so we're just kind of, looking into that, having those discussions to see where we can wiggle around with a pilot of sorts, maybe.
Yeah, I would just really like to see them provide something when we are providing $5,600 annually, to see,
Yeah.
what are the benefits of
More
that.
than, more than a piece of paper that says you
Yeah.
paid.
Yeah.
I believe other counties, like Lake County pays like 85 or something, so it's not
Yeah.
cheap.
Okay.
Yeah.
Population.
And
The
that's state law, right? That's required.
If we're, so
Accredited.
if we're not accredited and then we hit their deadline, then we can lose our ability to maintain our core services, which is most, I mean, for here, it's environmental health, honestly.
Yeah.
But is that a regulation or?
State
That's
state
state,
statute.
that's, yeah, they put in the
state
ORC.
statute? That's what I figured.
Yeah.
So that's a conversation with the, our state reps perhaps.
Yes.
All right,
Okay.
noted.
The,
I did have that conversation with Steve Demetrio.
I'll have another one. with him.
He was unaware of it.
Yeah.
the McDonald Hopkins, what time period is that for?
Yeah.
Those are a multitude going back to, I believe, January.
Okay.
So are we caught up now?
We are caught up now.
Oh, okay.
There's I think one or two new ones one new one that's came in, which is like the $500 retainer a month, but we haven't processed that one yet because it's just waiting in queue.
So this is January to June.
Yeah, that's I don't want to make sure I'm not completely butchering that because there's a bunch of them as you saw on the then and nows.
Right.
But yeah, it's stretching a decent time period right now.
What do we get for the $500 retainer a month?
January's in there. If I remember correctly, it's 2 or 3 hours a month that we get without any charge.
Okay.
And I usually use that every
You do
time.
use
Yeah,
that,
between HR or House Bill 110 has been the majority of it.
Yeah, we're always
Yeah.
Okay,
But
Okay.
we do use it.
very good. All right, is there a motion to accept the financial reports as presented?
So moved.
A second?
Okay, motion by Dr. Jones, second by Dr. Hendrickson. All in favor?
Aye.
Opposed? Abstention? Motion carries. Health Commissioners report.
A lot of stuff here this time.
Yeah, there's a lot of information for you, like, as the board progresses with more experience, what kind of topics you guys want to have, I'll put those together, bring in speakers, or we'll do that as a monthly education of the meetings, becoming a bit more brief to do that. But things I'm working on is looking at the state to help us develop a new software program, perhaps at the state level, kind of crowdsourced, to look at drunk driving, safe driving, drowsy driving, senior screening kind of things, potentially with a virtual system. We're also looking at the accreditation, looking at what kind of opportunities we have with that. And I'm on part of the bioterrorism team, so we send a consent letter to CDC where the locals have to agree that the money by the state is being spent in a positive, in a productive manner based on deliverables and money flows. So that was done, that attachment letter agrees with CDC. So without that, the state can't receive the $12 million such that they have to pass out. So that's so working on those kind of projects, make sure the grants are on track. So
The first one here about the state public health funding.
I just realized that.
So
Sorry.
what do we think GPH should do, or Lake and GPH? I mean, this was this is saying that there's not enough funding. Should we go? Should we really get to know this information and then suggest that, not maybe this year, but next year we put additional?
Yeah, so there's some monies in there that in the budget they get taken out most years. I think 3 cycles ago there was actually some good money for kind of beta test products with projects with these counties and the accreditation. That's all been pulled away. So we know Jerry Serino and Jamie Callender's on the budget commission, I believe, and so we're trying to look at putting it together once the budget settles and when it's appropriate, and using the county commissioners have given Brian Durrell to contact with him as a lobbyist to help forward some of these projects for funding. So we'll put something together, and the boards and the health officials can sign that, and we'll have some proposals about to shift some funds around public health.
It does make me wonder as well, since, you know, we have a very new and potentially trend-setting model of cost savings, to see if that's something that, you know, this could be a springboard for other counties to take a look at alternative options such as what we've pursued.
Yeah, absolutely.
I mean, when you have an article and a study out there that says the impact of chronic underinvestment in public health, you know, the public has to begin to understand that we have a funding issue, and the question is whether or not we, you know, our board, whatever we wanna do, what should we do going forward?
Yeah, there's a cost analysis, like the fundamental deliverables for public health. There's something like that out there. Robert Johnson, there's a 21st century project they're working on. The problem is that everything says it's $7 to $9 per capita, and the state's giving us like 19. You know, so depending on your county, you may be pulling in more local funds or grant funds or foundation funds. So our goal is to create an infrastructure, at least in our region, to pull in more federal grants, and we have to do that directly in the meantime, and advocate for the state to reallocate existing taxes perhaps to public health. But when you're at 19 cents and anything else is $5 or more, you know, that makes too much of a case we're underfunded. So you have to find where the money is and tell the story.
And I was gonna say, when Ron said $7 to $8, I said 19, it's 19 cents.
Yeah.
Not $19, so that's what we get is 19 cents, we're supposed to get $7 to $8.
If you're accredited, you get 38 cents or something.
Yeah, it's like double.
38.
Yeah.
No one else pays for your fee.
We hit the jackpot, Jethro.
Yeah. So, yeah, anything that topics, finances, those would be great things to put in. We'll put them in the board, either as a supplement or as a presentation for the meeting.
Well, I appreciated the
Yeah,
information you
thank
put in
you.
this time.
You're welcome. Thank you.
Yeah.
There's a lot of reading, but
I don't know.
Yeah, so that's for the bills that we usually do when you guys approve the bills, the motion.
Okay. So I need to read all of this?
No, you already did it, we just need whoever
Oh, okay.
first, and we can always just go back to the video and do dice.
Okay.
But it should have been 5, I remember vote yes.
5 yeses, 0 no's. Okay.
This is the finance.
I'm gonna start just passing these down when we start when we start voting on stuff, I'll start passing these down one at a time.
Very thorough.
And we'll collect them on this
okay,
end.
what
Yeah.
are we signing here?
That's for the motion that we already did to approve the bills for the
The
month.
finances,
Oh.
right?
Yeah.
Okay, it just looks very different to me
Yeah,
still,
no, it
so.
looked different to me too. Okay, moving on from the health commissioner's report, we all good on that? Okay, no committee meetings, old business, HB 110 review.
I talked with Mr. Kostura yesterday. I got the contract back to authorize that you guys already authorized. I can sign it. The PO is open, and we'll start working with the company to start getting that money processed. You guys approved the transfers and the expenses last board meeting, so we'll start getting those paid out. We had some people call in to Dan's team asking, like, when's it going? Who's it going to? So we'll start processing that. As a reminder, that will draw down the sewage fund to darn near zero. We're transferring money in just to make sure it doesn't go negative. So it's gonna be, that fund's going down significantly. So other than that, that's just kind of that one right now.
So when's that gonna start?
I'm hoping if I can get the PO open by the end of this week, we can have the contract back to them and process like Monday, Tuesday of next week.
So basically August 1st.
Yeah, probably. Yeah, best case scenario.
And we haven't had anybody reach out to us since.
Mr. Larkes has been reach out to his staff asking about the House 110 money.
Yeah, we've had a couple businesses, have say stuff to us like, when can we
Yeah.
expect things and stuff like that, so.
Okay.
You wanna talk about the levy, Adam?
Yeah, so Ms. Brakey was there at the meeting. There were 2 commissioners at the meeting yesterday, and so it was decided it was not going to be put on their agenda, so they're going to put it on their agenda for this coming Tuesday, which is the 1st, if I remember correctly, and that is pretty much about as close as we could possibly get. So they wanted to vote on it when all 3 commissioners were there, so I will be there next Tuesday.
Because isn't August 5th the?
August 8th is when we have to have it to the Board of Elections, because it's due August 9th, but August 8th is the day we gotta get to them.
So we have two commissioners meeting between then and now?
There is, I think the 9th was technically we would have one more. My goal was to have at least 2 weeks buffer in
Yeah.
case they go, hey, this wording was incorrect, can you please, because ours was special wording from the prosecutor side because our levies fall under a different code than what the normal ones do. I think the closest we are, the entity we're closest to is probably Board of Mental Health in terms of how the verbiage is used. So they custom did that for us. I just don't want to get this close to a deadline for a big thing. This isn't like I can just go, hey, well, we'll fix it
Agreed.
Friday. I also was hoping to bring it to you guys and say they approved it to go on the ballot so that you guys were, okay, we get it, we know where we're at, let's move on. So I'll let you know
Okay.
Tuesday.
Yeah, can you keep us updated
Yes.
on, if they vote and how the vote goes?
Not on here on old business, but still old business. We do have the outstanding lawsuit from like 7 years ago. We are getting additional requests from that, so I'm working on those
Okay.
from documents from 2016.
Requests from the plaintiff or?
Yeah,
Okay.
it's going through legal, so we're getting those, and that's sucking up a lot of time right now. It's finding
Okay.
stuff from
That's
2016.
the Bludenberg?
So just an FYI, it's nothing crazy, but it's just a lot of stuff that's taking up time with us and our county prosecutor's time.
Financial reports.
When are they supposed to go to trial on that? Like October?
It's been pushed back so many times, I couldn't even tell you, because it was,
Yeah.
I can't tell you how many times we've been told we're going to trial.
Yeah, those are always fake dates.
Yeah, it's been pushed and pushed and pushed.
It's like, you never trust those dates.
Right. So the finances that Ms. Berkey just mentioned, that was the thing that we just signed. I think we voted on that like we normally did after my section, but it is listed in resolutions now just so we can do things consistently. So, which is.
Okay, yeah, I was just gonna grab this. Those are the ones that were already done.
I guess the question is, do we want to vote on the resolutions that we can write who first and who seconded?
Yeah, I think, actually, did you write down for the,
For the finance report?
yeah,
It was myself who motioned.
And I think I second.
okay.
Oh, no.
No, it was Dr.
For
Hudson.
finance.
Second,
Second.
sorry.
Jones, I'm keeping track of the motions too, so.
Awesome,
Okay.
thanks, yeah.
Thank you, Dan, 'cause I promised to, and I bring everything right with, so yes.
Alright, so should I go to this one then?
Yeah. Sorry, and I was answering questions from somebody in the county, so I'm trying to get them information.
Okay. Alright,
And these are done individually, just so it's, that's how the county wanted them done. So you've got one, it was that updated agenda we sent out, so it's actually not the one that's up here, but it was definitely one that was on Facebook.
alright, so we need, so this is resolution, am I in the right one?
We just did 7.0101, we voted on that.
Okay,
early.
that's
Or
already
7,
done,
yeah.
I'm sorry.
That's, no,
I
confused
jumped
you.
again.
Because you guys authorized, you guys paid, you did the bills, which was that financials,
Okay, so
was the
this
bills.
one,
But the,
We-
sorry, I'm confused because this is a different resolution. This is this one. Okay. hold on.
Yeah, this was the one we already passed around,
Okay.
was the
This is the right agenda. Okay. So now we need to do, I don't have one for this permission to pay, and we don't need anything to sign for that, to pay McDonald Hopkins settlement agreement.
No, we don't need anything.
Okay.
I've already done that and processed it, but it's something that we need to go in front of you guys. So it's just an actual vote.
All right, so we need a motion to pay McDonald Hopkins settlement agreement appropriations were not in place at time of invoice was initially issued because of an oversight. Money was therefore appropriated and invoices issued again.
Yeah. So this was, there just weren't appropriations put in place to pay
Okay.
the bill. We entered into the contract with them. So we had to go back and put appropriations in place. And then this was the way that legal said to do, was do a settlement agreement.
Okay, that's
which
why I'm like,
is-
what are we settling?
Yeah, it's
on?
just
Okay.
saying we're gonna pay their bills also.
Okay.
All right, so is
understand.
there a motion to pay McDonald Hopkins settlement agreement?
I have a question.
Yeah.
Is that more money in addition to what's already?
No, that's with.
That's that money?
Yeah.
Okay, thank you.
So moved.
I second.
All right, motion by Dr. Rude and a second by Dr. Hendrickson. All in favor?
Aye.
Aye.
Opposed? Abstentions? So the motion carries. Rescind portion of appropriations approved June 28th, 2023.
So the $1 million that we approved to be paid out of general fund to pay back the House Bill 110, we need to rescind that because we have changed it to pay it out of the sewage treatment fund, which was deemed to be the appropriate fund to, we were doing it out of general because general is generally easier. But as I was talking to Mr. Lighty in the auditor's office, I said ideally we should pay it out of the sewage treatment. He goes, I would agree. And I said, okay. I said, so you last board meeting approved paying out of that fund. We started the process. And now we just need to rescind that $1 million so it doesn't show up on our books as being something we just never processed.
I'm glad you said that because I was a little confused when you said it was going to draw down the sewage fund,
Yes.
so that, okay, that makes
Yeah,
sense.
it was one of those things that as I talked through it, I was like, I really prefer to pay it out of there.
Yeah.
We had the money in place, but given that we had the time to do it, we didn't put the money in place last board meeting. I just didn't have time to put a rescission on the last one to get it processed by the time I talked through the whole process.
Okay.
So we're just rescinding the $1 million portion that we already approved for the other fund.
So is there a motion to rescind a portion of the appropriations approved at the June 28th, 2023 regular meeting?
So moved.
And then second.
All right, motion by Dr. Jones, second by Dr. Hendrickson, all in favor?
Aye.
Aye. Opposed, abstention, motion carries. All right, resolution, here, this is the one.
Now
we
we'll
got.
start doing these.
All right, oh, I've got, this is a multi-page.
Yeah, they've got all kinds of stuff.
Okay, resolution 2023-12, then and now purchase order to Conduit not to exceed $12,500. So we need a motion to adopt resolution 2023-12 to authorize the payment of a then and now purchase order to Conduit, total not to exceed $12,500.
What's conduit?
Conduit is who we do our community health needs assessment through, that we have to do at the hospital. So that's the company that helped prepare the report and do that. And that was that's half of the payment.
Okay.
During some of the transition, we noticed that certain POs were not opened in time. So we're going back and correcting that.
So moved.
Second.
Okay, motion by Dr. Rude, second by Dr. Jones. All in favor?
Aye.
Aye.
Aye. Opposed, abstentions, motion carries. And Adam, this is to sign a separate, I don't see another sheet, am I?
Which one's that one?
It says, board members must sign all cover sheets and tab documents, but there's, do they want us to sign here?
Yeah, you can sign in the corner. That's the county auditor's document, but they wanted signatures on theirs. I did not want to change their document though, because that's
That's all right, I just wanna make sure I'm doing
kind of verboten to do that.
what we're doing, right?
I think I'll get in trouble. And that was somewhat of a new process, to my understanding they have, so we're going based on what
Okay,
they
so
want us
we're
to do.
supposed to sign, I think, these tabs based on this. Okay. All right, is this 13? Okay, so resolution 2013, then and now purchase order to Flannery Gargalis not to exceed, really, $153.25?
Yeah, we have to do it based on what the invoice was and what the PO was open for. And again, there was a PO opened in, I think it was January or February, but it was open for the old firm, not the new firm. I don't check every PO, obviously, it goes out the door, or that is opened up, and so you can't pay the old firm, or the new firm with the old firm's PO. So now we have to go back and do these to make it right.
Okay, so is there a motion to adopt resolution 2023-13 to authorize the payment of a then and now purchase order to Flannery Gargalis not to exceed $153.25?
So moved.
And second.
All right, Dr. Rude made the motion, Dr. Hendrickson second, all in favor?
Aye.
Aye.
Aye, all opposed, abstentions, motion carries. All right, I'm sending this one down, guys, and there's also some tabs we have to sign.
I made sure they put tabs on it because I know it's easier for me to find where to sign to.
Yeah,
So.
all right, so that one's going down. Okay, resolution 2023-14, then and now purchase order to Flannery Gargalis not to exceed $750. So I need a,
So moved.
all right,
And second.
Lynn Roman made the motion, and Dr. Hendrickson seconded. All in favor?
Aye.
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 Opposed? Abstentions, motion carries. This one has a bunch of tabs too.
Ron, I'm curious, the conduit payment, given it's with UH, should actually vote.
It's a separate company. Conduit is actually independent. It's part of the Center for
We
Health.
pay UH pays part of it too. So that's why it's not like a black, I mean, it's not a black
I
and
don't
white
think
one,
you
it's
need to
probably gray.
abstain.
Well, if it makes you feel better, I didn't know about it, so,
Okay. I assumed you didn't, I don't know why you would, but.
yeah. No, I am
I'm
not
going through
directly
like paper
affected, nor does that directly affect me.
All right, resolution 2023-15, then and now purchase order to Flannery Gorgalis. So I need a motion to adopt resolution 2023-15 to authorize the payment of a then and now purchase order to Flannery Gorgalis not to exceed $43,898.90.
So moved.
Dr. Rude
Second.
made the motion, Lynn Roman seconded. All in favor?
Aye.
Opposed? Abstentions, motion carries.
And as everyone's signing these, we are caught up with the House Bill 110 program, so these level of invoices from a legal firm should not be incurred in the future unless something unexpected comes up.
That's not.
I mean, I'm not, I mean,
Say
believe me,
that.
every time I say we're, something.
Find some wood, start knocking.
But yeah, as of right now, we've wrapped up and it's going to that other firm, the claims administrator, so just an FYI.
All right, so now I need a motion to adopt resolution 2023-16 to authorize the payment of a then and now purchase order to Flannery Gorgalis not to exceed $5,145.
So moved.
Who's taking it?
Right.
Let's go Dr. Rude.
I heard Dr. Rude
I'll
first.
second it.
Okay, and then Dr. Jones made the second. All in favor?
Aye.
Any opposed? Abstentions? Motion carries. This is a lot of signing today.
I know.
It is.
My
I'm getting
signature's
real
getting sloppy.
Real sloppy.
And then the last, there's one additional one that's on the new agenda that was not on the other one, and that is a DEX imaging. That was another one, I think it was from January, that was not, that didn't have a PO open for it, so we're doing that one as well. And for those who don't remember, we just had one at DEX because there was not one open for 2 copiers that were purchased, I think in November or December.
And remind me, how is it that these weren't opened?
Oversight, not gonna blame, it's GPH's problem, not gonna blame anybody.
Is there only one tab on this baby?
Yeah, that one should just be the,
Okay.
I think just that.
All right, so this is resolution 2023-7. I need a motion to adopt resolution 2023-7 to authorize a payment of a then and now purchase order to DEX Imaging, total not to exceed $7,926. Is there a motion?
So moved.
A
Dr.
second.
Rude, Dr. Hendrickson with the second. All in favor?
Aye.
Aye. Opposed?
If you can sign that second page, sorry. Do that, yeah.
I'm
that-
already-
Oh, sorry, you did.
I'm
You
already
got
on
it.
it.
There's no sticky thing on that one, so I'm confused. I'm like,
There's a
or is there one on that one too?
Yeah,
I
we're
didn't
good.
see it.
We're good. All right, we had an executive session on this.
Yeah,
So
I left it
let's-
there for the legal thing, but it was innocuous when I finalized it. I'm working with the prosecutor's office and the county auditor's office, so I'll give you an update when there is one, but as of right now, it's so small, it's not gonna be anything worth your time.
Let's skip it.
Yep.
All right. Anything else before we move to public comment? No? Good? All right. 2 minutes per speaker.
Yep. I'm gonna pull up well, I'm pulling this up, the other thing I will say is, my wife has put up with me for 15 years as of today, so I'm taking her to dinner after this, so I appreciate us getting out of here at a reasonable time.
All right, no executive session.
Yeah, she's on her way here to take her to dinner.
And she said, "Go."
This is great.
You
All
won't
right,
be
we're
here.
rocking and rolling today, guys.
The lovely couple, would you like to
Oh, I
speak?
didn't say.
I did have a
Wow.
question. You were saying that some of the testing came by, I think you said 1,500 of the salt. Is that, now that the issue has been taken care of, is that gonna resolve itself over time, or is that always gonna be there?
So groundwater flows, so theoretically, most things then when they go, they do kind of go out into a plume. So it probably will disperse and lessen over time and get flushed out to a certain extent, but the speed at which groundwater moves and changes over is extremely slow. So any My best guess is yes,
But
but I
that
don't
means-
know when or how.
Okay.
Yeah.
And that was one thing I think the train derailment and let people understand. 'Cause I think a lot of people thought groundwater traveled like a stream. It's just nonstop, and it's really slow.
It's feet per
Yeah.
year.
Yeah, it's like feet per year. So it's
Yeah, I heard that too, yeah.
yeah. That was one thing I think the train derailment taught people is that this is not like a stream of water just going crazy.
That's a really good question though.
Yeah.
Is there like a super rough estimate, as far as groundwater, like, you know?
What was on
So we had a presentation about wells with the guy from ODNR, and he gave a real good explanation of it. But if I remember right, I mean, he was saying groundwater, especially people who do wells, it's only moving like anywhere from a couple feet to maybe 10 feet a year. So really, real minimal movement of groundwater through those lower depths.
I would almost wonder too if it's dependent on so many things such as soil type, yeah,
I'm sure it does if you get a
element or
nice sand
whatever running
aquifer,
through,
things will move a
yeah.
lot faster where, you know, if you have a shale where it's just moving into
Yeah,
those layers, it's gonna
yeah.
be a lot slower, I imagine.
So many things that would affect it.
It was shockingly slow though, because people thought like that. Well, we were in a different watershed too. But they thought the water was come up here, and it was like I think it was like
Yeah.
years they quoted it would take that. If for someone that traveled the opposite direction of gravity, it would be like years.
Interesting.
Anyone else? Questions? Yeah.
The handsome gentleman next to the lovely lady.
I'm relaying kudos to Commissioner Graham. I met with the Deputy Department of Emergency Services for Geauga County last week. And he was very complimentary on your participation in the BioWatch exercise. So that was a good thing. Another thing is congratulations on getting your contract for the field monitoring teams from Energy Harbor, and Bert deserves some
Yes,
kudos because he was persistent and tenacious. You know, the person he was dealing with isn't that easy of a person to work with.
Thank you for the public, both counties, so thank you so much.
Yep. And should mention, this benefits Geauga County as well, because
Yes.
you covered 3 counties, right?
Yeah.
That should do it as well.
Thank you.
We good? Nothing?
No.
I'm good. I'm Alex Emerson. I'm from Geauga Times Courier. It's nice to meet you.
Yeah.
It's my first public health meeting.
Okay.
Not your first commissioner meeting.
Didn't fall asleep. Yeah.
See you from there. The gentleman behind the camera. I almost have to ask you because Rich asked you for like years. I feel like, so.
All right. Meeting adjourned.
Apparently it's done. Dr.
At-
Reed, great job.
Yeah, at 5:52 p.m.
That's just the shortest meeting.
This is, but
Shortest
highly
regular
effective.
meeting.
This is a victory, I'm telling you. We just won the lottery.